Level 1. No insurance. You feel a sharp pain in your chest. 2 a.m. You sit on the edge of the bed in the dark. You don't move. You don't call anyone. You wait it out. The pain doesn't go away. You still don't call. You can't afford to call. The cheapest ambulance ride in your zip code is $1,400. You sit until sunrise. You don't sleep. You go to work at 7. You tell no one. Same chest pain, same hospital, different insurance. Watch how the system decides who you are before the doctor even sees you. A week later, the pain comes back. You Google your symptoms at 3 a.m. You close the tab when you see the word heart. You go to the free clinic on Tuesday. The doors open at 8. You arrive at 6:15. You are 47th in line. The lobby smells like floor cleaner and old coffee. The chairs are plastic, the lights buzz overhead. Nobody looks at anybody. A woman next to you holds her chest with one hand and her child with the other. She tells you Tuesday is the only day the cardiologist comes. You don't ask how she knows. At 11:40, they call your name. The nurse has been on shift since 7. She doesn't ask your name back. The doctor walks in at 12:03. He is on his 8th patient. He listens to your chest for 40 seconds. He types more than he listens. He says the word cardiologist. He says you need to follow up. He doesn't ask if you have one. He doesn't give you a name. You leave with a printed sheet, 3 bullet points. The third one says, return if pain worsens. Outside, your phone buzzes. Your mother is calling. You stand in the parking lot for 3 seconds. You answer. She asks how you are. You say you are fine. The lie is automatic now. The lie has become a survival skill. The hospital doesn't refuse you. The hospital just makes you afraid of it. Level 2. Medicaid. You qualified after the layoff. The application took 11 weeks. The card came in a paper envelope. You call the schedule. The earliest appointment is 4 months out. You write the date on the calendar. You write it in pencil. The day comes. You wait an hour in the lobby. You wait 40 minutes in the exam room. The doctor enters at 1:47. He types more than he talks. 7 minutes. He orders labs. He doesn't tell you what they cost. The bill arrives 6 weeks later, $340. The labs were not pre-authorized. You call to dispute. You are on hold for 47 minutes. A voice picks up, reads from a script. The script has been read 1,000,000 times. You hang up. You pay $12 a month. You will pay $12 a month for 2.5 years. Medicaid doesn't deny you care. It just makes care deny you. Level 3. Marketplace Bronze Plan. $340 a month. 8 months. You believe you are covered. The pain hits on a Wednesday. Not your chest, lower, sharp. You drive yourself to the emergency room. You can't think about money. You can barely walk. It is your appendix. Surgery that night. 3 days in the hospital. The bill arrives 6 weeks later. The envelope is thicker than a magazine. $48,000. Your insurance covered the rest. Your portion is $9,400. You sit at the kitchen table. You hold the bill under the lamp. You read it 3 times. The math doesn't change. You apply for medical hardship. You are denied. Your income exceeds the threshold by $3,000. Insurance at this level isn't protection. It's a permission slip to be bankrupted slowly. Level 4. Standard PPO. Employer-sponsored. You pay $140 a month, they pay the rest. A small cough. Persistent. You call on Monday, you see a specialist on Wednesday. The waiting room has chairs that aren't plastic. The magazines are from this year. A nurse calls your name on time. The doctor sits down. He looks at you. He asks a question. He listens to the answer. 22 minutes. He orders blood work. He says he will text you the results. You pay a $30 copay on your way out. You forget about it before you reach your car. The bill arrives 2 weeks later. $327. You pay it that night. You don't think about it the next morning. You walk through the parking lot. You see a line of people at the entrance you used to use. You used to stand in that line. You don't anymore. The system stops noticing you at this level. That's the goal. To be invisible to the machine that ruined you. Level 5. Premium Executive Plan. Your company pays $28,000 a year for your coverage. You pay $0. You call at 9. A receptionist named Maria picks up before the second ring. She schedules you for 2 p.m. the same day. You arrive at 1:45. A different waiting room. Wood walls, soft lamps. The chairs have leather. There is no one else there. The doctor walks out to meet you. He calls you by your first name. He shakes your hand. He asks how the kids are. 45 minutes. He asks about your father's heart history. He asks if you sleep well. He asks if you have been traveling. He gives you his cell number on a card. He says, "Text me directly." He says, "Don't go through the office." You leave through a side exit. There is a fountain. You did not know there was a fountain. At this level, the system stops being a system. It becomes a service. And service has a face. And the face has your name in its phone. Level 6. Concierge Medicine. $300 a month on top of insurance. 1 doctor, 400 patients total. The average primary care physician has 2,500. Your annual physical lasts 90 minutes. He pulls up your sleep tracker data. He asks about your wife's stress level. He calls your trainer on FaceTime. He tells your trainer what to focus on. A month later, a hike. Something sharp in your knee on the descent. You text the doctor at 11 on a Saturday night. He answers in 4 minutes. The next morning, an orthopedist is at your door. He sets up in your living room. He brings a portable ultrasound. He sends the scan to your phone before he leaves. You realize you have not waited in a waiting room this year. You have not filled out a form in 14 months. You're not booking appointments at this level. The doctor is renting time for you. Level 7. Mayo Executive Health. $11,000 for the annual. 2 days. A private wing. Your name is on the door. Full body MRI as a baseline. 300 genetic markers. 47 separate blood analyses. Your results are reviewed by a panel of specialists. You do not meet them. Their reports arrive on encrypted PDF. The chest pain comes back, months later. The same pain from the bedroom at 2 a.m. You feel it on a Sunday afternoon. You press one button on your phone. 12 minutes later, a helicopter lands on your property. The medical team was assembled in 90 minutes. The hospital was organized around you before you arrived. The suite has a view of the lake. Your family is flown in that night. You don't see the bill. You never will. At this level, the hospital doesn't treat you. The hospital is organized around you. Somewhere right now, someone sits on the edge of their bed at 2 a.m., a pain in their chest. They don't move. They don't call. The system hasn't broken. The system is working exactly the way it was built. Final truth. You are the same body at every income level. The hospital just decides who you are before you walk in.